I'm Barry LoSasso. I'm a pediatric surgeon at the Valley Hospital. Well, my career at the Valley Hospital started fairly recently. I've been here in New Jersey, working at the Valley Hospital for 6 years. But before that, I was the director of the Children's Hospital of San Diego's chest wall deformity program, and I did that for 16 years prior to coming to New Jersey, and I was on staff at the Children's Hospital in San Diego for almost 35 years. My journey has been a long one in pediatric surgery and in treating patients with chest wall deformities, but here in New Jersey it's been just five years. One of the senior pediatric surgeons at Valley Hospital, Dr. Ranjandir Gandhi, and his partner, Dr. David Friedman, knew me during my fellowship at Columbia Presbyterian Hospital, helped to train me almost 40 years ago, kept a close friendship with me and was very aware of my interests and my passion in caring for patients with chest wall deformities, and offered the opportunity to come back to where it all began on the East Coast, join them in practice, and bring my experience and my knowledge with regards to the Nuss procedure to this part of the country. And it's just been a wonderful, wonderful last 5 years. I'm so blessed to have an amazing team of specialists at Valley to help me providing that kind of care. I appreciate most the dedication of the entire organization to caring for patients with not only the more common problems that are part of the community here, but that dedication to caring for patients with very special conditions and requiring very special surgical programs to take care of those special needs. And my program, doing the Nuss procedure and treating patients with chest wall deformities, perfectly matches the approach that Valley has and the commitment that Valley has to providing specialty surgical care for patients in this region. My philosophy of patient care is first and foremost to educate my patients and their families as to what the medical challenges are that they're confronting, and to explain to them the process by which they can address those challenges. And I try to present in a very logical way a holistic approach to the problem that starts with them understanding it profoundly and deeply, and then understanding how it might be affecting their health and well-being, and then explain the process, the journey, so to speak, which starts with evaluating them completely, understanding how their heart and lungs may be affected by the condition of sunken chest, understanding all of the various ways that we study their anatomy and physiology and help them to understand how the condition may be affecting them specifically, and then what their options are for treatment, both operatively, of course, and non-operatively in patients who have a very minor deformity. And then, most importantly, take them through the journey of correction, help them to understand what some of those challenges might be if they commit to correcting their chest wall deformity, and then being there for them through that journey, not only in the operating room, but beyond, during their rehabilitative phase of care, up until that wonderful day when we go through the removal of the implants, which then allows them to pursue their life in a more healthful fashion. I was fortunate enough to learn the Nuss procedure directly from Dr. Nuss, and over the course of a year, within a year of him reporting his first 45 patients to the world, I joined him in Norfolk and learned the operation directly from him 15 years into my pediatric surgical career as a pediatric surgeon in San Diego. And so over the course of a year, I went to Norfolk and I learned not just how to do the Nuss procedure, but also how to select patients who would be good candidates for the procedure, how to then do the operation safely and effectively, and then help patients recover from the operation, which requires about 3 months to do so. What I hope to achieve is educating the patient completely and allowing them to make the best decision for themselves and their family.